All right, guys, we are here to talk about basic first aid. Okay, so here's some basic, first principles, right, to follow. So stay calm. Okay, that's easy to say, but you're instinctually going to want to panic. Okay, so what I like to do is give myself 5 seconds to panic, and during that 5 seconds of panic, I assess the scene for safety issues. Right. So let's say a brick fell on somebody's head right over there, and you're like, oh God, what do I do? Oh my God, oh my God, oh my God. While you're doing that, take a look and see if that wall's about to fall, right? If it's not and somebody accidentally just threw a brick over it, go in there and pull them out of the way. No, I'm kidding. You want to make sure and get them to a safe area. So, once that's done, you want to call 911. If certainly if there's any life, threatening emergencies, such as having a brick fall on your head. But there's also a couple things to keep in mind, right? So you always want to wear gloves when you're treating blood or bodily fluids. A lot of the time that goes along with some sort of injury. So if you have them, definitely wear them. You will have them because they're in your kit, okay? So know where the first aid kit is located, okay? So at operations, we have a full OSHA, compliant first aid box, and it glows in the dark, and you'll see it when you go in there. In your kits, right, in your totes, I'm gonna have something just like this, okay? So we're gonna kind of go over these things too as we work on our training here. But let me go through some topics I think that, are just general that you're more likely to run into, okay? So, you possible, minor cuts and scrapes, these sort of things, they do happen. Okay, what you want to do is wash your hands. You want to clean the wound with soap and water, okay? Apply an antibiotic ointment, right? You can find your antibiotic ointment right here in the first aid kit. There's a package of different, creams and salves and ointments and things like that. So you should have everything you need right there, as well as a copy of a care guide, right? So that has everything we're talking about in here as well. So if you're there and you need a reminder, that's there as well. Just to care for a scrape or cut, you're going to want to change the bandage daily, or if it gets wet or dry while you're working. But these are really times that you want to use those gloves, especially, right? You don't want to get it infected. So be sure to watch for signs of infection, which would be redness, swelling, pus, things like that. You might also run into minor burns, right? There are hot things we're working with. And so what you want to do is you want to cool the burn by running it under water, cold water, for 10 to 15 minutes. Okay, it seems like a long time. It is a long time, but what you're trying to do is you're trying to get that skin cool again. Don't apply ice or greasy substances like butter. Those things will actually make it worse, right? You're going to want to cover it with a clean non-stick bandage. There's Band-Aids right here and here, okay? Pro advice here, let's, seek some medical attention if blistering happens. Obviously that was a bad one, right? For chemical burns, rinse it thoroughly, and then check the label, right? You might want to call, Poison Control Center. Most of these things have something called an MSDS, okay, which is a material safety data sheet, and there's instructions for what to do in all those. So if you do call the doctor or an advice nurse, they have access to all that stuff. Okay, so sprains and strains, these are more possible, right? So you might hear me say something if we talk like follow RICE, right? No. So I might just say, go home and RICE, right? RICE stands for rest, ice, compression, and elevation. So you know how the doctors always say, okay, well, get off your feet, put some ice on it, compress it, and keep your heart up, your foot above your heart, for example. That's what RICE is, okay? So what you want to do when you're doing the ice part of that is just apply it for 15 to 20 minutes at a time. You want to wrap it in a cloth, right? Just so that it doesn't, ice burn your skin, so make it worse, right? Some tips here, use an elastic bandage for support, okay? Just so that it'll help kind of keep it braced a little bit for you. And seek medical advice if there's any swelling, bruising, or inability to walk on it, right? If you can't bear weight on it, then you definitely need to go to the doctor, okay? You might end up with some eye exposure to chemicals, right? So let's say you're spraying Windex and the ammonia hits your eyes. The reality is that it's just going to cause some irritation for a short amount of time. But you still, you want to rinse your eye, right? Immediately with clean water for at least 15 minutes. I don't know if you've ever seen one of those eye clean cups, right? There. Anyways, it looks like, something that you just put your eyeball over with some water in it, and you do that, and it kind of just flushes the eye out with water, and that should help a lot. When you're doing that, keep your eye open, right? Your eye wants to stay shut. Make sure it stays open. If you don't have an eye wash cup, then you can use like one of the sink things that have a handle on it, right? And just open your eye and just let it float into there, okay? Seek medical advice right away, right? Even if the eye seems fine, you don't want to risk it, okay? So fainting and dizziness, this one's important because, it could be caused by some things like heat stroke, or, something as simple as, maybe you didn't eat that day. Maybe it's a reaction from a chemical that you're using, right? So the first thing that you want to do is to make sure that you're in fresh air, right? Because if it is carbon monoxide and they don't have a detector, you sit in it, and that's one of the symptoms. You start feeling, dizzy, okay? So always get yourself to fresh air. That's the first thing you want to do. If it's appropriate and you're very, very dizzy or you're about to faint, make sure and lie down. So if you do faint, you don't fall and crack your head, okay? Loosen super tight clothing, okay? And like I said, get fresh air. That is so important. 9 times out of 10, it's something environmental that you can, help yourself by just simply removing yourself from the room. So if you run into somebody that, is dizzy or something like that, don't give them food or drink until they're fully alert, right? That's really, really important. If they end up fainting and they vomit and their head's like this, they can actually choke. So if that does happen and they're like, no, I really need something to drink, and you give them something to drink, they pass out, then make sure and tilt their head like this so that if they do vomit, it doesn't go down their throat and choke them, okay? Call 911, really. If they remain unconscious or unresponsive, you just have to do that, okay? If somebody's bleeding, all right, so this is where it gets a little bit more, serious, okay? So there's certain things to do on levels of bleeding. So moderate to severe bleeding is probably the most important thing to think about. It's not a Band-Aid, right? We got something serious going on. First thing you want to do is you want to put on gloves, apply firm pressure to the wound with a clean cloth, okay? If we're gushing blood, right, and it looks like you have the potential for it to bleed out, you need to take off your belt and put a tourniquet on that thing. But most often it's not going to come to that level. I mean, you would literally be seeing blood gush out. But typically what you want to do is apply firm pressure, okay, to the wound with clean cloth. They're not going to like the firm pressure, trust me. But that's what's going to keep the bleeding under control, all right? And then you want to keep doing that until the bleeding stops or help arrives, okay? Really important, guys. You want to get that out of there, right? There's pathogens and things like that in blood, so also really, really it's important to wear gloves. If the blood soaks through the gauze or whatever you're using to, a bandage of some sort, then put more cloths on top of it. Don't remove it. You don't want to pull off extra skin. That's more of a procedure, so leave that for the doctors. Just put more gauze on top of it, okay? And then again, for call 911. If there's severe bleeding or you can't stop it, oh my gosh, you better call 911, okay? If you had to use a tourniquet or put pressure on it to stop the bleeding for, a significant amount of time, call 911, right? You're just gonna have to use your best judgment. Okay, so some certain things that you're always going to want to call 911, and that's going to be any signs of a stroke or a heart attack, right? Because these sort of processes can, go intermittently for quite a while, okay? Excuse me. So signs of a heart attack or a stroke are things like chest pain, slurred speech, weakness. Those are really important to keep your eye on. If somebody says, I'm having chest pains, then get on the phone, call 911, okay? If you notice that they're having slurred speech, and they don't seem drunk, ask them a couple questions. Say, how are you feeling? Any, tight chested or any weakness or anything like that, and wait for their answers. Okay, maybe it is something very standard. Don't go just assuming. Again, that's really important. So if there's severe allergy, we do have things in the first aid kit that can help you deal with that, but it's one of those things that if you're seeing swelling or they're having difficulty breathing, you need to call 911, period, done, end of subject. You don't want to get to the point to where the throat swells up and you can't do anything, right? Because I don't want you guys putting in tracheotomies, right? So that's really important. You also, if it's uncontrolled bleeding, loss of consciousness, severe burns, broken bones, you need to call 911, okay? And they need immediate attention. Also, we need that on record that we did something. So both are really important, okay? Look, it's better to call 911 and not need it than to hesitate during a true emergency. So, if you could tell, like, look, this person is clearly, something like a stroke, but they're, embarrassed, they don't want to call an ambulance, whatever it is, you're still going to have to use your best judgment, okay? That's just some important things to keep, in mind as far as first aid, okay? Be safe, okay? Protect yourself. Watch out. Some of our customers can, be vulnerable, and they might need first aid themselves. So you never know what's going to happen, okay? Thank you.